Okay, so here we've got a couple of radiographs of the left knee in a skeletally immature patient. We're looking at both frontal and lateral views. And right off the bat, there are a few key things that jump out. First, there's a clear lipohemarthrosis, which, always raises the suspicion of an intra-articular fracture. That finding is pretty important because it essentially confirms that we're dealing with something going on inside the joint. Now moving on to the bony abnormalities. There are multiple fracture fragments we need to talk about. One of the fragments is located right near the medial femoral condyle, which could suggest some sort of avulsion injury there. And there's another fragment just hanging out over the fibular head, right next to the lateral tibial plateau. That's interesting because it points us toward a possible lateral tibial plateau fracture. Oh, and don't miss the fracture through the medial tibial spine. Though, to be honest, we can't really see the full extent of that one clearly in these images, so we'd want to keep that in mind. Now, what's not there is equally important, right? I don't see any significant flattening of the tibial plateau that would scream major instability, but I wouldn't rule it out just yet. And there's no obvious ligamentous damage that we can see from the bones alone, but we know that with this pattern of injury, soft tissue structures, especially the ligaments, are often involved. So, based on all of that, the most likely diagnosis here is a Seguin fracture. This is a type of fracture that happens when there's abnormal internal rotation and varus stress on the knee. It's often subtle on radiographs, but crucially, it's very strongly associated with injuries to the anterior cruciate ligament, ACL, as well as meniscal tears. So yeah, this is a big deal in terms of potential knee instability. But before we get too ahead of ourselves, we should also think about the next steps, right? What do we need to do next? Well, I'd recommend an urgent MRI because, as we said earlier, we need to get a better look at the soft tissues, ligaments, menisci, all of that good stuff. The radiographs can only take us so far when it comes to soft tissue. If there's any doubt about the bony structures, we might even want to throw in a CT scan just to get a more detailed look at the fractures. Now, if you were sitting in an FRCR Viva exam, I can pretty much guarantee the examiners would have a few follow-up questions for you. For instance, they might ask, what's the significance of lipohemarthrosis? And the answer is that it's a sure sign of an intra-articular fracture. The fat from the bone marrow leaks into the joint space, mixing with blood, and voila, you've got lipohemarthrosis. It's a pretty reliable indicator when the fracture itself isn't immediately obvious. Another thing they might ask is, what about ligamentous injury? Why are you concerned? Well, with a Seguin fracture, there's a super high association with ACL tears and even meniscal damage. This isn't just a fracture you treat and forget about. There's a lot of soft tissue involvement that we need to address. And that's exactly why the MRI is critical. They could also ask, how are you going to manage this? At this point, I'd say I'd involve the orthopedic team early on. We need their input to decide whether surgery might be needed, especially if the soft tissues are as involved as we suspect. That MRI will give us the rest of the information we need to determine the treatment course. All right, so that's the case. If you found this video helpful, don't forget to hit that subscribe button, give it a like, and drop any questions or comments down below. I'd love to hear from you.